From Niagara Health, we welcome Heather Paterson. She's the interim VP Clinical Services and Chief Nursing Executive. Heather, it's a chance to celebrate and recognize the nursing team at Niagara Health, and let's just admit it right now, there's no better time to celebrate them, to thank them for everything that they've been doing over the last 14 months.
Yeah, exactly. It just is coming at a really good time for us. The last 14 months have been so challenging. And so we're just so proud of the team and the resilience that the nursing staff have experienced and done over the last 14 months. It's just been really inspiring to see the hard work that they've done for our patients and their families.
What kind of activities are planned at Niagara Health? What kind of, focuses are you putting on the nurses?
Yeah, so we've done a few things this year. We actually, Niagara Falls will be lit blue from 10 to 10:15 on Wednesday, May the 12th. As well, the hospitals across Brant, Burlington, Haldimand, Hamilton, and Niagara will be lighting their buildings blue, just as a sign of solidarity for our nursing teams. As well, we do Nursing Excellence Awards, Mike. And so this year we've had a record number of nominations for nurses that have worked in the last year and have just exemplified what we're trying to promote here with patient care.
It's incredible when I try and wrap my head around what life must be like for these nurses in the hospital system and outside of the hospital systems, nurses working in long-term care homes and in other medical facilities.
Yeah, there's so many changes and challenging moments that we've had over the last 14 months, and it's something that we haven't experienced before. This pandemic has just pushed us to think about things differently. We've had to be very fluid and make changes, day over day, just to make sure that we were keeping our patients and our staff safe. And I think that our nurses just were up to the challenge, and they always kept the focus related to our patients and their families and how we can provide a really great, exceptional experience for them. And so I'm just very proud of them.
Those early days of the pandemic when so many nurses were deciding, well, I might have to stay in a hotel because I can't bring anything back to the family. Things have settled down a little bit more, so life is a little bit better for the nurses, I would think, as far as that home and work balance. Would you agree with that?
I would agree with that. And I think that what we've seen over the last 3 months is just all the work that we've done with our vaccinations. And just to be able to see our Niagara Health team, as well as our colleagues at Public Health, set up the vaccination centers, and to see nurses actually be able to get their vaccine and just feel safer to provide care for their patients, and then as well going home to their families. It was a daunting task at the beginning because we really didn't know what we were dealing with, and so it was just great to see all that work that everybody put in with the vaccination.
Do you predict that this will have any impact on nursing programs and applications to them in the future at the universities and colleges?
I actually do. I think that what it's done is highlight all of the work that our nurses do on a day-to-day basis. But I think what it also has done is showed the community that there's just different types of nursing. There's nursing in hospital, long-term care homes, the work of all our nurses in public health. And I think that as a career, there's so much opportunity for young people to explore nursing as a career, and it can take you to all different opportunities and positions.
Heather, I have a sister who's a retired nurse, 30 plus years in the profession. I know she did it for all the right reasons, and I believe that's the truth for all nurses. They don't do it for recognition. Are some of them uncomfortable when they get recognized like this?
Yeah, I'm a nurse myself. And so you're right. We come to work and we focus on patients and we focus on families. And so when you're elevated to by the community as heroes, it's hard sometimes for nurses to see that, because we come to work for different reasons, focusing on patients and families. But what we've seen through this is just the community recognition and the support that we've received at the hospital, and it was in community donations and food and signs. And I think that for nurses, it was just the acknowledgement that, the community really appreciates what we do, and they're supportive of us. And it was actually overwhelming for many of the nurses to just experience that.
Well, you all deserve the praise. Happy Nurses Week, and thanks for joining us, Heather.
Thanks so much, Mike. I really appreciate it. Take care.